afternoon. I'm Dr. Sahinbas. I'm radiation oncologist. I was several years, more than 10, 12 years in a university hospital for radiation oncology and medical oncology. I'm also specialized on radiology for diagnostic treatments and interventional radiology. I'm also doctor in palliative medicine. And since 1998, I'm on the way with complementary medicine, especially with hyperthermia. And I want to introduce you about the hyperthermia. As the oncologist, we have good, in the past 5 or 8 years, very good results in some cancer entities like melanoma, like leukemia, like lymphoma. And in the past 5 years with the new immunodrugs, we have success in some other tumor entities. But sometimes, in some cases, the tumor is very aggressive, is growing very fast, and has resistance against classical oncological treatments like immunodrugs, so that we have no chance to help our patients. This slide shows only in the past 40 years that we have not real success and that we not cure our patients, more than 50% of our patients. So it was proven 10, 20 years again later, but it didn't change really so much. In these special cases where we have no real success, like in brain tumors, like glioblastomas, anaplastic astrocytoma, like sarcoma, like pancreatic cancer, we have no chance and no real good results, and it didn't change the past 40 years. For this case, or in case of recurrences, we have additional good oncological treatment options. And one of the options and the main option is the hyperthermia. We have an international consensus group about hyperthermia. Everybody is talking about hyperthermia, but nobody knows or understands each other, because we have more than 22 different hyperthermia forms. So main form is I can help actively that the body can produce his own fever. The most chronic disease patients, including cancer patients, are not able to react with a fever, which is natural reaction in case of disease, infection or cancer. And the most patients are not able to fever again. This calls active hyperthermia. If it's not possible, we can support the patient with a total body hyperthermia. It means we can heat up from outside with special machines in range of moderate fever range temperatures. It means 38 to 40 centigrade. It's not very high, but it's effective and enough to make an immunological response of the disease and to increase the efficacy of radiation therapy as well as from many chemodrugs. If we have some localized problems, the region of interest, for example, pelvic cancer, it can be ovarian cancer, cervical cancer, rectum cancer, or liver metastasis or lung metastasis, we can use additionally the local hyperthermia as well. And all the treatment options can be combined with each other. depends from the chemo drug, depends from the oncological treatment, and depend from patient situation, general condition. These are few of the available machines in Europe, and they are also in US used. This is also in Korea or Russia available devices. We know we have more than 42,000 publications with hyperthermia in combination with chemo drugs, with radiation, with immunological reactions. And we know that we have non-thermal effects. It's not depending from the temperature, but it makes some positive effect on the total body of the patient. This is one or more or less an old publication from 1977. It was proven 20 years later. It's proven just now last year and also this year. This is the effect of radiation therapy on the tumor activity. This means we need more or less 12 units of the radiation dosage, but we can have the same results if we are able to combine the radiation with the hyperthermia with 50% of the radiation dosage. This means, on the other hand, we can double the effect of the radiation on the tumor cells. In case of that, in recurrence, that we cannot use a high doses of radiation, means that we can do additionally hyperthermia and will have effect as such as a total high doses of radiation. And the radiation hyperthermia has not an additional adverse side effects on the healthy skin. These are a few of the multiple studies. This is a summary from 23 randomized studies with hyperthermia and radiation therapy. And all the different entities and outcomes with and without hyperthermia shows a benefit for the additional hyperthermia. And this is very significant, the results. So we have a lot of good randomized international studies in different tumor entities, and all the studies where was able to make a combination with hyperthermia has much more success and much more effect. So we cannot change the guidelines. It's the hyperthermia is not an alternative medicine to something, and it will not be used alone. But it should be not used alone. But we have our guidelines in oncological treatment with radiation, chemotherapy, surgery, but we can do additionally the hyperthermia, local hyperthermia, as well as total body hyperthermia, depends from the chemotherapy, to have more success, not more, but also not less. And all over the studies with hyperthermia shows that the patient can have 30–40% more success. It means more survival time, prolonged survival time, or get healthy with the hyperthermia. Hyperthermia in oncology is also one part of his effect. We have a randomized, controlled international study with other chronic disease, here in this case, depressive disorder, and 3 times per week, in total 9 sessions, and the patient have also prolonged time with much better effect, antidepressive effect of the hyperthermia. So if we summarize, so as take-home message, what we are doing is we are going sometimes back to the roots. It means we help our body to produce his own favor, to fight against inflammation, infection, as well as against cancer cells. So it is not only artificial treatment, it's a like normal natural treatment. And hyperthermia in the studies is showed it has very positive effect. It can be combined with the classical oncological treatment. We can stabilize the immune system of the patient. We can prolong the survival time. And on the scientific way, we have very good results, but it's not accepted from the insurance or from the politics. The companies who's producing the devices are not able to do for each tumor entity one randomized study. So it's, in my opinion, it's also not necessary. Our problem is we have a lot of international hyperthermia societies and national hyperthermia societies, but we have not an address for the politicians and for the insurance. So what we need is an independent department or faculty of hyperthermia where we can collect all the knowledge and where can be addressed if the insurance or politicians have special questionnaire. So what we need is the help from outside, maybe from European Parliament, to installate a faculty of hyperthermia in any university in Europe. It's possible so that we can handle in name of the colleagues and in name of the hyperthermia societies, and that the department can be addressed for any part of questions, and we can summarize the studies and can help the patient. That is our main problem. I hope I infected you with the hyperthermia, and I hope you can help us in the future to bring this hyperthermia one higher level, as we are just in the past 50 years are staying on the same position. Thank you very much.